Resuming debate, reprise de débat, the honourable member for Vancouver, Kingsway.
Thank you, Madam Speaker. I'm pleased to rise today as health critic for the New Democratic Party to speak to Bill C-233 and the urgent need to address the impact of dementias and Alzheimer's disease on patients, families, communities, and our public health care system. Dementia disease is a progressive, degenerative disorder that attacks nerve cells in the brain, resulting in loss of memory, thinking and language skills, and behavioral changes. The disease forms lesions in the brain cells of patients, causing nerve connections to sever and nerve cells to die. Alzheimer's is the most common form of dementia, which is a general term used to describe a group of symptoms such as loss of memory, language, motor skills, and other brain functions. Alzheimer's is not part of the normal process of aging and currently has no cure. Bill C-233 calls for the development and implementation of a national and comprehensive strategy to improve health care delivered to persons suffering from Alzheimer's disease and other forms of dementia. This bill prescribes a number of elements that must be included in the national strategy, including greater investment in research, the establishment of national objectives for care, coordination with international bodies that fight dementias, assistance to provinces and territories to improve treatment, strengthen prevention and early intervention, and disseminate best practices. As prescribed in the bill, the details and benchmarks for these elements would be determined at a conference convened by the Minister with multi-stakeholder representation. New Democrats have long believed that Canada needs an ambitious and comprehensive national dementia strategy to improve care for the hundreds of thousands of Canadians suffering from forms of dementia and to better support their families and caregivers. As Mimi Lowy-Young, CEO of the Alzheimer's Society of Canada, has said, by implementing a strategy, we will be able to enhance research efforts, raise awareness about the disease, provide support for people with dementia and their caregivers, identify best practices for care, and improve surveillance of the disease. Particularly as Canada's population ages, we must prepare our healthcare systems and our communities for the inevitable rise in the number of Canadians suffering from dementia. To paraphrase Tommy Douglas, the father of Medicare and a New Democrat, only through the practice of prevention will we keep healthcare costs from becoming excessive. And the need is pressing. Recently, the former head of the Canadian Medical Association, Dr. Chris Simpson, said this: "Our acute care hospitals are overflowing with patients, often dementia patients, awaiting long-term care placement. Our long-term care facilities are understaffed, underspaced, and under-equipped to care for our most vulnerable seniors. This leaves patients and their families in limbo, struggling to fill these gaps in our system." Mr. Speaker, Madam Speaker, the need for national leadership is urgent. Few Canadians are untouched by these diseases that often have shattering impacts on families. The struggle to cope with the deterioration of mental faculties and the loss of memory can be overwhelming and heartbreaking. According to the Alzheimer's Society of Canada, that disease and other dementias now directly affect 750,000 Canadian patients. This number is expected to double to 1.4 million by 2031. Current dementia-related costs, both direct medical costs and indirect lost earnings, have reached $33 billion per year in Canada, and they are projected to soar to $293 billion by 2040. Currently, the burden of care for patients with dementia and Alzheimer's falls primarily on family members. In Canada, family caregivers spend an estimated 444 million unpaid hours per year caring for dementia patients, representing $11 billion in lost income and 227,000 lost full-time equivalent employees to our workforce. If nothing changes, by 2040, it is estimated that family caregivers in Canada will spend over 1 billion unpaid hours every year providing care. These numbers, Madam Speaker, are staggering. Taken alone, they make the case for our desperate need for national leadership. Canadians overwhelmingly agree. A recent NANO survey revealed that 83% of Canadians say they want Canada to develop a national plan to address these diseases. We mustn't forget that dementia also has a disproportionate impact on Canadian women. According to the Women's Brain Health Initiative of Canada, women represent 62% of dementia cases and 70% of new Alzheimer's cases. putting them at the epicenter of a growing health issue. In addition to this, women are nearly twice as likely as men to succumb to dementia and 2.5 times more likely to be providing care for someone with the disease. Unfortunately, Canada is now one of the last developed countries in the world without a national strategy to address dementia. We have fallen behind countries such as the US, UK, Norway, France, Netherlands, and Australia, all of whom have coordinated national plans in place. In Vancouver Kingsway, I've heard countless heartbreaking stories about the impacts of Alzheimer's and dementia on my constituents. Many cannot afford quality home care for their parents or face long delays in accessing long-term care facilities. Many do not even have access to the resources or information they need to make important decisions as they witness the cognitive degeneration of a loved one. I've heard stories from personal care workers, nurses and physicians who report emergency wards that are overwhelmed with patients, long-term care facilities that are understaffed, and long, grueling hours for caregivers, often working for low pay in the homes of dementia patients. These stories underscore the need for leadership in this chamber. Now, as New Democrats, we are proud of our long history of leadership on health care, and specifically dementia care. In fact, it was the NDP that first introduced to this House a proposal to create a national strategy for dementia. In 2012, former NDP MP Claude Gravel introduced Bill C-356, prescribing a national dementia strategy in Parliament. That bill provided a comprehensive and cutting-edge plan for a national strategy to deal with Alzheimer's and dementias. Unfortunately, that bill was defeated at second reading in May 2015 by a single vote, 140 to 139. The bill was opposed by a majority of Conservative MPs, Bloc MPs, and critically, as it turned out, a single Liberal MP who failed to stand for the vote. Conversely, our New Democrat caucus voted unanimously in favour of Mr. Gravel's bill. And again, I must mention that inexplicably, the member for Niagara Falls, the sponsor of the bill before this House today, voted against that national dementia strategy just one short year ago. Now, most charitably, I might say that wisdom comes so seldomly that it ought not to be rejected because it comes late. Less diplomatically, I might say that the honourable member owes Canadians an explanation and an apology for defeating the very concept that he proposes be adopted here today. What is indisputable is that if that House had followed New Democrat official opposition leadership in the last Parliament, Canadians would have a national dementia strategy in place right now. And Canadians would not have lost precious time, something especially important to those suffering from a progressive illness. Madam Speaker, New Democrats do not take lightly the opportunity to move forward with a national strategy for dementia. We believe this bill must be crafted correctly to ensure the best possible outcome for patients, their families and caregivers. While we support Bill C-233, it is less ambitious in its scope and implementation provisions than the former Bill C-356, the New Democrat bill. Important differences between those bills include an absence of any provision to augment volunteerism for dementia and Alzheimer's-related causes, no remuneration of advisory board members, only one public report required from the minister versus the yearly progress reports prescribed in the former NDP bill. Now, New Democrats will work at committee stage to bring about meaningful and substantive amendments to this bill to strengthen the final product. Canadians deserve no less than the best national Alzheimer's and dementia strategy possible. New Democrats have a long and proud history of advocating for federal leadership on healthcare issues. In fact, we invented it. It is critical that in a country like ours, the federal government work to ensure that all Canadians have access to the health care they need, no matter where they live, no matter what their income, and no matter their background. New Democrats stood alone in this House unanimously for a national dementia strategy in 2015. We will stand unanimously in this House in 2016 and work so that every Canadian family, and every caregiver can have a world-class dementia strategy, as the NDP has fought for the last 5 years. Thank you, Madam Speaker.